Hi, I'm Penny. I'm a chiropractor at Spinal Care Clinics. So what first got me into chiropractic? Initially, I wanted to do something in healthcare, but I didn't like blood. So I looked into what I could do in terms of conservative management. But actually, years ago, when I was very young, my dad was struck down with lower back pain, debilitating, and was told by the GP to have painkillers and bed rest, which didn't get very far. And a friend of his actually recommended a chiropractor, and it was something that freed him of the issue. And so it was very interesting to see that for myself. So observing chiropractors, there was something about the adjustment that really drew me in. And that's what made me follow on to looking into becoming a chiropractor. I'm very thankful that I did. It's been really rewarding to see the changes that can be made for people over the years that I've worked here, the experience that I've gained through this profession. My interests particularly are chronic issues, whether that be chronic lower back pain and leg pain, chronic neck symptoms, neck and arm, shoulder, headaches, the kind of things that linger for a long, long time. And they obviously take time to get to a problem, and how we can help to unravel that and actually look holistically to get to the root cause of the problem rather than just treating symptoms. And that's what I'm most passionate about and what I see great results in. My approach tends to be quite gentle, but obviously it varies depending on who I'm seeing. It could be that I'm seeing a rugby player. It could be that I'm seeing an elderly lady with osteoporosis. So of course we do vary how we manage each individual case. There's certainly quite a variety of things that we see from babies up to sports, and it's not always just pain. It's also looking at posture and other kind of issues that aren't always associated with symptoms. So I am looking quite holistically when I see a patient. With my approach, I tend to look at the whole spine rather than just looking at where any symptoms are. It can be that sometimes a problem can be away from where the presenting pain or issue is. And so having a look at the whole person and certainly looking at their environment is very, very key. I tend to practice with an emphasis on lifestyle. So looking at how we can align what you're doing day to day with what's going to help to allow your body to heal and recover at its best. And that's why it's so great to be working in a practice like this where we've got everything under one roof. We've got the massage therapists, we've got the PTs for the functional rehabilitation and fitness. We've got the nutritionist, and we look at the mind-body link as well, and mindfulness coaching, looking at everything, putting it together with the chiropractic to get the best results that we can. If you're unsure about seeing a chiropractor, all I'd say is just try it. The first point is a consultation. We'll go through investigations, a thorough history, see what's going on first and foremost, whether we can help you. Then we'll explain everything in detail as to what your problem is and how we can help before going through exactly what the chiropractic adjustment is. And once you experience that, then you can find out for yourself what kind of things can happen from an adjustment. One patient who springs to mind is a lady who had chronic hip pain for about a year or so, and she was getting more kind of numbness and tingling more recently into the leg. And within a few weeks of chiropractic care, she was doing fantastically well. And everybody's different at what rate they respond, but she did really, really well from quite early on. But she built on her program with the Activate. So looking at the nutrition, the exercise, putting everything together, and her results have been phenomenal. She's changed her lifestyle and she's got a lot of energy. It's really, really lovely and rewarding to see. If you're struggling with pain or you want to improve your health, just come and book in for a consultation. I'd love to see if I can help.